I know many of you folks have experienced this. I talked about it a few weeks ago, how Sasha had a bum knee. We talked about the tear of the CCL, what happened, the rehab that we did, amazing. But here's the reality. And what's been on my mind, and it's probably on a lot of you guys' mind, is how do I prevent a second knee injury in my dog? And I got to tell you, I'm really excited because I've got a very special guest today that's a master in the subject and doing so much rehab in orthopedic, canine, and beyond. And we're going to tackle the subject, and we're going to tackle it hard because, well, in a good way, because we really want to have not that issue happen. The statistics, as we're going to cover, are really high that this is likely to happen. But let's bring the expert on the line. That's standing in the wings with us. And as you can see, it is going to be Dr. Debra Canapp. And I'm so thankful that she's with us today. So let me bring her on board. Here we go. And it goes the magic of bring 1, 2. There we go. Hey, Dr. Canapp, thank you so much for coming online with us.
Thank you. Thank you very much.
So I know many of you folks know you, particularly in the world of canine sports, but if you could talk a little bit about your background and really, as we're going to go into this subject of a second knee injury, which stresses a lot of us, a lot of pet parents, canine athletes, handlers always worry about that. But tell us a little bit more about you. What do you do? What is canine rehab and what do you do?
Yeah, so I started in canine rehab kind of at the dawn of rehab. And so it's been now 15, 20 years. Yeah, it's amazing. So I was an emergency clinician prior to that. I was a little worried about, going from saving lives to kind of waving magic wands over dogs and kind of massaging them. And it is so fulfilling to watch dogs that are in pain actually, become active again and feel good. It's an extremely rewarding area of veterinary medicine.
Well, we're excited that you're here, and you're right. It's a field that's been developing. It's getting more and more increasingly popular. And if you folks just join us, we are here with Dr. Debra Canapp. She's an expert in canine rehab, and you're going to want the show notes of this event because what we didn't share yet, but there's a lot of cool stuff that's going to happen. So you're going to want the show notes. Dr. Canapp has also prepared a really cool video to help us in the prevention aspect. So in the notes, in the chat, just go down below and just put the word prevent. And I'll put it on the screen so that you guys don't forget this. We've got some really cool stuff. And so I'll talk more about some of the giveaways that Dr. Canapp is doing for us. So we understand your background and the seriousness and the importance of the rehab aspect of it. If you can maybe dial us back a little bit and talk about knee injuries, because it seems like when I work with a lot of my friends in the canine sports, specifically in the hunting world and whatever it might be, very active, it's a very common problem. So can you tell us how common are knee injuries in what you're seeing in your practice?
It is actually the most common injury that we deal with. On a daily basis, at least in our clinic, we see almost 30 injuries in the knee a week. It's incredible.
Wow.
So it is one of the most common, unfortunately. It's across the span. It could be companion dogs, it could be hunting dogs, it could be agility dogs. Nobody's kind of protected from it. Some breeds are a little bit more predisposed, but some are, not. They still have it because kind of freak things happen.
So unfortunately, it's keeping you in the practice busy and very specifically about the knees.
Yeah. Yes, I mean, it's just one of the most common injuries. It's kind of, again, our typical surgery that's going on and on and on.
Wow. Folks, if you've just joined, I am with Dr. Debra Canapp. She's an expert in canine rehab. She lectures around the world. I've actually seen you in different places lecturing, very thought after from veterinarians, actually. So we're very privileged to have you here and talking to us. And so we're talking about knee injuries. As a matter of fact, if you just joined, make sure that in the chat that you put the word prevent. Dr. Canapp's got some really cool stuff that she's providing videos for us. You'll get the show notes. And she's giving away one free consult so that we're going to be providing for you folks. So there's going to be one really lucky winner that's going to get that. As a matter of fact, as well, folks, when you're if you hear something that you're learning, something of value, as you're listening to this show, please make sure to let us know, because the value as well is that we'll be able to know what's important to you. So specifically, when you hear something that's a value for you and knowledge, just put in the notes as well, hashtag Paw Love. And by the way, we're giving away a 1 TDC bottle, which I know you use in your practice as well, and with your dogs, actually,
Taking myself.
and yourself. That's
Part of my routine. Yeah.
so. Let's talk about a little bit more about what is the most common knee injury in dogs, because there's different types. Is what you've shared with me in the past.
Yeah. So the most common is a ruptured ACL. So that's just or an ACL in a person or a CCL in a dog, and that is the most common injury. It's again unfortunate, but at least we studied it a lot. We have some really good techniques to fix it and get them back to doing what they love or getting them back to sport.
Got it. So from that standpoint, and I think as we're getting into the core of understanding, really about CCLs and those stairs, ACLs as well, what causes that? And why is it that it's so prevalent, as you were sharing with us earlier?
Yeah. So, I mean, it can be a range of things. It can be something from a freak accident where they are just running. Say they're doing a trial and they're running down a field and there's a little bit of uneven earth and they kind of step in a hole, and that can cause it. It unfortunately can be genetically predisposed. So it's not, it's not like hip dysplasia where we say, oh, this line of dogs can have it. But unfortunately, depending on their slope, so the tibia has a type of sloping dog, and if it's really, really steep, then it can actually predispose them for ACL tears. And then there's the whole realm of stuff that we don't know much about, but say like tick-borne disease that causes inflammation within the body. And so when we see that in joints, actually they can break down ligaments and stuff like that. So we also think that can kind of predispose them to having an ACL rupture.
Got it. So there are a lot of factors in what you're describing. I mean, you're talking about the genetics, you talk activities, freak accidents. I know in my case with Sasha, and I've tried to do a really good job warming her up and so forth, and you're going to really teach us about that. But even then, it happens, and it's just heartbreaking when you see that dog limping and in pain. You don't know how severe it is, and going through that one knee injury. It just
don't want to do it again.
You don't want to do it again, and it takes a while. I mean, it's not like it's fixed in a week. So there's a lot of time and frankly suffering of the animal and the anguish of the dog owner as well.
And like a lot of suffering of the dog owner. Yeah, really active dog, confined into a sense of not running, is very difficult.
Well, if you just joined, I am privileged to be with Dr. Canapp, who's an expert in canine rehab. She's talking to us today about knee injuries, and specifically, we're focusing on really trying to protect the other knee we're going to talk about. So in the show notes down below, you're going to want those show notes. So in the notes, make sure you put the word protect. That's going to give you access to the show notes. We're also doing, really, Dr. Canapp is doing an awesome giveaway of a free consult, a virtual consult that you guys are going to be able to do. And we're giving away some of the 1 TDC product as well, which is commonly used in the rehab aspect for those issues. Okay, so let's talk about this knee injury and really specifically, okay, how common, and I'm literally reading this question, how common is the chance for my dog, for my little Sasha, which had one injury already, to tear the other CCL if they already have one torn side? And I'm going to tell you, and I'm sure you know the statistics better than I do, but I actually found the statistics in some very, very credible source, which obviously your world, the American College of Veterinary Surgeons. I mean, look at this number. 40 to 60% of dogs that will have a CCL tear in one knee will, at some future time, develop a similar problem in the other knee. So how credible, I mean, I know it's scientific, but how credible is this number and how serious and common is this?
So there was actually a research paper done in 2009, and that's where that number came from. So it was looked in Labradors. And so they kind of studied a big population, and it showed that it was greater than 50% of these dogs that had one ruptured CCL, that they would go on and rupture the next one in a 5-month period of time. And it's just, overwhelming, right? Because you go through, it's 12 weeks of rehab, 12 weeks of healing. And then you get out the end of it. And so if that's 3 months, you've got 2 more months, and then all of a sudden it happens again.
Exactly.
It's, yeah, so it's kind of really scary. But this was also done in 2009. So that's why I think we've got some good techniques and tools now to try to prevent that and really lower the number.
Okay, well, we want to first understand, as we're going to go into this, is so, and perhaps if you can explain to us, because like I told you, that's been my biggest fear with Sasha, is the other thing's going to go.
Yeah.
So the question is, why is it that there's a higher chance for that CCL to actually tear? Is there something specific that we should be in tune and understand before we go into the prevention?
So it's a lot of things that kind of go into the fact that they put more weight on the opposite leg. So they injured their first CCL, they get surgery. It's painful, right? And so they're holding up their leg, and they're putting way more weight on the other side. And so there's been studies that actually look at that also. And we know that the inflammatory mediators in that other knee start increasing like K2. It's insane. And so it's just all things that we want to try to do, or all things that cause the possibility of that happening, is weighting that leg too much. In addition to, we're looking at some of the surgical tactics that we use that we prefer at my clinic do something called a TPLO, where they kind of cut the bone and rotate it. Well, we wait for that bone to heal. That's how we kind of gauge are they healed or not. And so what happens is a lot of wonderful surgeons look at that radiograph and they go, look, it's healed. Okay, you're free. Goodbye. You know, and the dog doesn't have enough muscle mass on the other side. So because they don't, they go on and they're still kind of favoring that opposite leg, and then boom, you know, it can lower that pressure.
So that makes sense. It's really, to your point, it's that link from fixing, that process of what's happened during the fixing and how that can impact, I guess, the muscles, the structure, all of the structure of the other side, enduring that fixing, that can wear it out or put it into a position where it's more likely to happen. You know, it's funny because on the human side, I've seen that. Like if I hurt on one side, I look funny, and then I start hurting on the other side. Now, not that dramatic, but that's definitely key. For those of you folks that just joined, we are here. We're honored to be with Dr. Canapp, Debra Canapp, an expert in canine rehab, and she's talking to us all about knee injury and really leading to how do we prevent the other knee from getting hurt. So if you've just joined, you're going to want the show notes. You're going to want the incredible video she put together about prevention for us. And all you have to do is go in the notes, in the chat specifically, and just put the word protect. I screwed up on the screen here. It says prevent, but it's protect. My bad, folks. So please put the word protect on there. We'll fix that. So now let's talk about a little bit more now as you explain to us why it happens. Talk about a little bit more about some of the key reasons why the injury actually is getting hurt. Is there something specific that's happening as you're talking about putting more weight? And what are some of the typical reasons that you see as well?
Yeah, so it really is based upon putting more weight. And because those structures can't take that additional weight, you cause like kind of an inflammatory cascade within the knee. And inflammation will break down any ligament, no matter where it is. And so it's just it's kind of like a race in time, you know, trying to get more weight on the surgical leg that was just, you know, repaired, making that leg feel better, building up muscle mass in that leg so it can actually evenly support the dog once they go back to their activity. So it's really kind of, you know, trying to stop that process from happening.
You know, I'm glad you said that, because in my experience with Sasha, what I noticed is when you talked about inflammation, the other side, I could literally feel the heat, like in the quads and sometimes actually the hip as well at the top. Oh, yeah. So yeah, it's really a battle. I mean, we're really trying to fight or reduce, I guess, this inflammation to a certain extent. Yeah, no, that's wonderful. If you just joined, we're here with Dr. Canapp, Debra Canapp, who's an expert in canine rehab, and she's giving away a free consult. So in the show notes, we fixed it here on the screen. Make sure that you put the word protect, and she's going to be in a position where you're going to be in the drawing, you're going to get the free video, and we're giving away, talking about promoting healthy inflammatory responses. I know one of the things that you do use in your clinic is the one TDC to really promote healthy inflammatory responses. Okay, now let's go into the core of what we really want to know, and that is, What can I do to help prevent the other side from tearing? We understand the problem. We understand how we get there. But the truth is, what steps can I realistically take to really prevent this from tearing again? Or the other side, I should say.
Okay. So, I mean, the number one thing that I recommend is actually prevention, right? So, what can we do to try to prevent the first thing anyway? And that's putting your dog on nutritional supplements. So, like the magical three that I have is one TPC, glucosamine chondroitin sulfate, and an omega-3, like a fish oil fatty acid. So, the combo of that three, I recommend for all dogs to start at 1 year of age, especially if they're active, right? So, if you have a little couch potato that's not, challenged anatomically. Like I think of a French, more like an English bulldog as a couch potato, but they're so anatomically challenged that they need it anyway at 1 year of age. So we start them on that for 1 year of age, and we know for the people who are done, oh God, many years ago, actually, I did it with my husband, and we showed that starting these joint supplements before injury actually helped them heal faster after. So we want them on board. That kind of one idea there.
So from a prevention standpoint, that's that is a common question that people ask actually before you even get into the world of having injuries or knee injuries. Is there anything I can do to prevent? So I'm glad that as an expert in the field and as you've seen so many of the dog athletes, coming in the world of hunting as well, all those that very high driven world. So you really do recommend that it is done preventatively or proactively, I guess is the way I would say.
Proactively at 1 year of age. So even so more important when you have an agility dog or a sporting dog or a hunting dog, these guys are going to be pushing it. It's like an athlete in us. And so we really need to kind of support our body just that one step higher to try to help prevent little micro tears happening, that kind of build up as compared to no one's going to be able to prevent, stepping in the hole and one leg going this way and the other leg going that way. But, if we could do everything else with supplements, hey, that would be great.
Excellent. Now that's good insight because often for folks, that are dog handlers or hunters and so forth, or just, pet at home, is it? What do I use? So if you could just tell us your top three that you personally use again for preventatively or during a rehab of some sort.
The supplements. I'm sorry, you cut out a little bit. So I use one TDC. I use a glucosamine chondroitin sulfate, and then omega-3, the fish oil kind of base omega-3s. So I use those three as my basis for all dogs. And then, depending on their, abilities, or maybe they have a deficiency in something, then I kind of add things in.
Got it. So you've got your core, and then you adapt based on really the home care that you see is appropriate for your patient. Okay. Is there anything else going now? We've talked, or I should say, you've talked about the supplement aspect. You talked about one thing I wanted to ask you. One of my worries that I had with Sasha when we were rehabbing her knee injury is she's a high-driven dog. She exercises a lot. Obviously, I couldn't do that anymore, or I couldn't do it nearly to that extent. I can imagine those agility dogs or those flyball dogs or even those hunting dogs that just want to go, and I held back, which is hard to hold them back sometimes.
Oh, yes, very hard.
What's your perspective on the dieting and how much do I cut back without messing up the metabolism? What is there kind of a rule that can help us?
Yeah, so I really base it on kind of how the dog feels. So honestly, in our sporting dogs, everybody is so kind of updated on nutrition and really wanting to keep their dogs lean that they almost err on the opposite side, right? So we come and we see these dogs come in with a knee injury. They are so lightweight, I'll say, right? So athletic that they don't have fat on them. That's really hard because they don't have that extra energy to heal. So for those dogs, I actually increase their caloric intake a little bit, or maybe the same, because they're going to be doing less exercise, but they need just a little bit more on them. Other dogs that maybe say overweight, then we make sure that we calorically reduce that, especially because their activity is going to be reduced. Having extra weight on that other knee that we don't want to rupture, that's another reason why we may kind of put it down that bad pathway. So we want to just make sure that they have enough body fat to heal things, and then enough or not enough, too much fat to make sure that they're not overweight.
Got it. Good. That's a really good insights for us, because the nutrition is huge in knowing what to do. So I really love what you said. And thinking back of Sasha, she was pretty lean. I did reduce, but not that much. In retrospective and listening to you, I probably would have kept her the same. So not that hopefully I have to do that anytime
Right,
soon,
exactly.
because I'm learning from you. If you just join us, we are here with Dr. Canapp. She's an expert in canine rehab. She's a wonderful guest, and she's got some goodies for us. Actually, I'll just put it on the screen so people can see that as well. We're doing some cool giveaways that we'll be doing after the show, actually. One is a free consult that someone is going to win. You'll get a one-on-one with Dr. Canapp. And we're also giving, we were talking about promoting healthy inflammatory response preventatively, and also during any form of training, or if you have any, a discomfort in the joints or the muscles, this will help. So we're going to give one of those away as well. Now, let's talk about a little bit more, because you put a really nice video for us, which we'll be able to share for those that put the word prevent in the show notes. I'm sorry, protect. And you'll get access to that. What are other steps that I can do to prevent that other knee injury or that tear on the other side?
Exactly. So say we do have that injury, right? So I think one of the biggest number one things to do first is find your surgeon, and then have that discussion of what the best surgical technique is for your dog. There are gold standards. Again, our clinic uses something called a TPLO, but that may not be the right technique for your dog. And so we look at size, we look at heat, we look at what are they going to go back to do. So and we put all of that in. We actually look at their scope and their bone structure. And so I think it's so important either to get multiple opinions or to have that in-depth discussion with your surgeon before you go ahead and run that surgery.
So really have that discussion with the surgeon if the surgery is the solution. And so to your point is, don't just fix one knee and have the holistic discussion of both knees and really put a plan together.
Yeah, and what your dog wants to go back to do. And again, it's just so important to make the right decision and with all the factors in, not just looking at an x-ray and saying, okay, well, this is what we do and we don't do anything else. You want to have that full discussion.
Got it. Well, in the ideal environment, and I know that's your environment as well with your husband, with Dr. Canapp, Sherman Canapp as well, is that he does the surgery and you guys put plans together from the rehab from the get-go. So there's a complete view of protecting the other knee and also helping the healing. So obviously that's what's always nice to have both of you at conferences, because you really cover the ground from the healing standpoint for the animals. Is there anything else? I know, can you tease us a little bit and tell us in that free video that we can have access? Just go into the notes, folks, into the chat, and just put the word protect, and you'll be able to have access to that. Tell us a little bit about that video and what you're covering in that video that folks are going to be able to view.
Yes, luckily all the bloopers are taken out.
Wait, hold on. I got to talk about the bloopers. I wish I wish I could throw it on the screen, but I didn't do that. But I think we'll subsequently have to do that. So as much as we're talking the dog world, it seems like there's a notorious cat in the Dr. Canapp's family that rules the show, even when you guys were doing this video, which is a riot. I was laughing.
And grabbing my leg, and it was great. It was wonderful.
So just to let you know, when you go into the notes, into the chat, and you put the word protect, you will not get the cat video version. You'll just get the dog video version, at least for now.
A separate, raffle for that one. So the video was kind of an approach of, what to help do to prevent an injury in your dog. And it kind of is a blanket to prevent any injury. And it goes through a warm-up, exercises, active stretches, and then cool downs and kind of techniques of, especially for your dog's knee, what can you look for that may tell you, hey, something's not exactly right here. Maybe you should slow down a little bit, take a day off, and things like that. So hopefully it's some good tips and points for everyone to take home.
There's some really good insights in that video that you and Ellie helped and put together. that is really nice. I was reviewing, of course, and you guys are going to have access to it. It's, from the stretching aspect of it, understanding in the relationship with your dog as well, the reading of it. And so you guys did it's a very short, very concise video, but definitely of great value. So if you just joined in, make sure to get access to this free video. Just go into the chat and just put the word protect, and you'll be entered into a drawing for a 1 TDC that promotes natural, healthy inflammatory responses as well. Okay, so I have a burning question for you, because what if I'm doing everything right? I'm feeding my animal right. I'm going through my rehab. The knee is doing better, and I'm taking every precaution that I can take. I know you're a very precise person, and unless you have an absolute, double-blind study, you're not going to give me a percentage.
Nope.
I know you. But to kind of make me warm and fuzzy a little bit, what would you say is the general reduction of taking all the right steps that you're talking to us? And we're at the end, guys, stay tuned. We're going to do a full recap of some of the key steps for you. Yeah. What would you say is within a huge range, so we don't hold you to a specific number, that you would say is likelihood I can reduce the chance of those crazy 40 to 60% chance that the other thing is going to go bad?
So, and it's interesting because we do have some data on this. So when I saw that paper, and kind of that paper came back to light for me, right? And I was like, you know what? The dogs in my practice don't have a 50% chance of tearing. So why is that? And I originally thought it was specifically because of the modalities that we use for rehab, like photobiomodulation, laser, things like that. And I went back and looked. It wasn't exactly that. I couldn't pinpoint which modality. But what I could show was that every dog that had equal muscle mass at the end of their rehabilitation, so that's one of the things we focus on, is making sure that they build up muscle. You have to do that with proper nutrition supplements, pain management, things like that. But if they had equal muscle mass, they did not go on to rupture the other ACL. And so we decreased that percentage almost to about 25%.
Wow.
We decreased it by 30 to like about 25 to 30%. So we brought it all the way down. And I guess at our clinic, I think we saw something like maybe like 10 to 20% dogs that would go on to rupture. Now, in that group, some of those dogs did not follow all the parameters, right? So we had to incorporate those in. But I can tell you from personal experience, the people that did follow, unless there was some kind of freak accident where they fell into the hole, they did not go on a rupture, which was awesome.
Wow. So what you're saying, following those steps, which we're going to recap in just a moment, you had a dramatic reduction in having a second knee injury, which is great, which is ultimately, like I told you,
nobody wants to go through it twice.
Absolutely. And what's nice is, as I'm going through your list, and we're going to cover that in a second, I'm looking what I'm doing with Sasha, because it's been a year and a half, and I'm constantly, trying to be careful. And there's check marks that I have on your list, and there are ones that I don't. So I'm definitely going to incorporate that and decrease this potential of coming back. That's wonderful. So, and then of course, there's always the freak accident, which that you can't put that in you can't control that.
It's called squirrel. That's what it's called.
Yeah.
Yeah. So it's just one of those freak things, it's just, unfortunately, that's how I ruptured my ACL. Freak thing. It wasn't, anything I didn't do preventatively. So that's always in there. But I really feel that we can reduce, like what that paper was talking about. Those 50% of dogs that went on to rupture weren't because of a freak accident. They were because they weren't managed correctly prior to their release. And that's the big takeaway, is to make sure that they are fully healed and fully muscled before they go back.
Well, and I think it's nice to be realistic as well. There's a high percentage that's going to happen. You can follow the steps that we're about to recap, and then you can really reduce your chances. And the truth is, those dogs, like we talked about, there are generally like I've seen Flybo and agility in the hunting, where all they can do is they can't wait to go out. And their brain is like going beyond what the body can do at times. So it really does take a lot of diligence on our part as pet parents.
Tremendous. They don't understand. They don't understand what they've done wrong, that they're not allowed to go and do the thing that they love the most. But at the end of the day, it's about gradual. It's gradual reintroduction. If we were laid up in bed for 3 months, we would not go out and run a marathon. The dog will, like, no question at all. And he will probably break several things when he goes out for the first time, unless you do it gradually. And it's the same for us. Like, we can't do that either. We don't have the endorphins and the adrenaline that they do. So end up hurting ourselves sooner, I think.
Well, and they're so dedicated too. I mean, those dogs are just amazing. All right, so we're gonna step back and do a nice recap. If you just joined in, you come at the right time, because we're gonna do a recap. And if you have not done that yet, make sure that you go into the chat section, put the word protect, just type it up, and automatically it's going to provide you access to a little flow that's going to give you the chance to win a 1 TDC bottle, and also really generous from Dr. Canapp. She's going to do a virtual one-on-one consult with one of you folks watching this show. And also, everybody gets access to the video on prevention, and really showing us visually how to do it. So that's really cool stuff. All right, so I'm going to start all over again so we can do a proper recap. So let me just put you back in the green room for a second. Here we go. All right, let's start. Let's get ready for that recap. That's right. Many of us have experienced a knee injury with our dog, and the question is, what's the likelihood that it's going to happen on the second knee? Well, the truth is the percentages are astronomical that it's going to happen. So today, to help us kind of learn some key critical steps to make sure that this second knee injury does not happen, we've brought an expert, Dr. Canapp, who is an expert in canine therapy and rehab. She works with all kinds of canine sports dogs, from hunting to flyball to agility to dog diving, you name it, and basic pet parents as well. So let me bring Dr. Canapp on board with us, and we're going to go over. Hi there, Dr. Canapp.
How are you?
So big subject. It makes a lot of us very nervous and concerned about having that second knee injury. And what we would love to be able to do right now is to get the chance to narrow it down to the top 5 tips that you can tell us as dog owners to prevent that second knee injury.
Absolutely. So the first and foremost is the prevention, right, of any knee injury, and that's making sure that your dog is on the proper nutritional supplements. So my 3 that I recommend to start at a year of age is a glucosamine converting sulfate product, an omega-3 fish oil product, and 1 TDC. So those 3 are the basics that I recommend for any active dog, especially our sporting, agility, flyball, hunting, field trial. All of those dogs really should be on those 3 supplements at 1 year of age.
Got it. Folks, you just heard it from Dr. Canapp. Tip number 1, prevention, the right nutritional supplements, glucosamine sulfate you mentioned omega-3s. Of course, we talked also about the 1 TDC, which promotes healthy inflammatory response. And I love the clarity of starting, 1 year. Don't be afraid to do it preventatively. So great tip. Okay, that's number 1. Let's go into tip number 2 for us, how to prevent a second knee injury, or frankly, any knee injury.
Yeah. So unfortunately, for number 2 is that you have 1 knee injury, right? But you don't want to go through another one. So it's choosing and I put in there, choosing the right surgery. Right? It's choosing the right surgeon, discuss the options, and then choosing the right option for your dog. Because what we want to make sure is that we reduce that pain and discomfort and increase the functionality of that initially injured knee as fast as we can. And so that's really, that could be surgery, that could be rehab, that could be a brace. There's many different reasons for many different options. But you want to choose the right one that's going to get your dog out of pain and discomfort and back to function.
Excellent. So get the right diagnosis, get the right treatment, and if surgery is needed, get the right surgeon. And I know in your case with your husband, who's obviously an orthopedic surgeon, people fly from all around the world to get that right treatment.
Yeah, absolutely. And really the right discussion. I think that's the most important, is that it doesn't have to be surgery. A lot of times it is, but it doesn't have to be. And it's really just looking at what the best is for that dog.
Excellent. That's a wonderful tip. Thank you for tip number 2. Okay, let's go into tip number 3, how to prevent that second CCL tear.
So once you have that injury, say it's postoperatively, you want to make sure that we're decreasing the discomfort of the dog as soon as possible. We do that through pain medication, so we want to make sure they're on the adequate pain medication, through nutritional supplements like 1TDC, to promote those healthy inflammatory processes. So we want to try to kind of get it on the healing cascade as fast as possible. And so just want to make sure we do that as quickly, so we're going and taking the weight off of the good leg, right? That's our biggest goal, is to prevent that second leg from injury, is to get the weight off of it and make them kind of a little bit more even as fast as possible.
Got it. That's a wonderful tip for us. Thank you for that. All right, let's go into tip number 4.
The hardest. So after injury, again, whatever choice it is that we're healing, if surgery or rehab, we need to make sure we restrict their activity. There's so many times, I can't tell you how many times, that people are like, oh no, they seem to be fine. I know it's 4 weeks ahead of time. I'm just going to let them run. And they come in with a second CCL.
Wow.
So it's just restricting that activity to allow that tissue to heal. It's usually about 12 weeks, and making sure that we entertain them in any way possible to kind of keep them safe. But that's so important to remember. We want that muscle mass to be equal before we allow them to go back to their activity. Be it a sport, be it companion, be it chasing that squirrel again. Want that muscle mass to be equal.
Got it. So key word that I remember, and I'll be very much looking at that on my dog, which I'm concerned with, is that equal muscle mass is achieved. Okay, that's an excellent point. All right, last, and I'm sure very important tip as well, number 5.
Yeah, and again, it's about achieving that muscle mass. So the muscle mass, and that's the data that we found to show the decrease, that great percentage of decrease in having that second rupture, is having equal muscle mass. At our clinic, we use nutritional supplements like 1TDC, the glucosamine chondroitin sulfate, and the omega-3s. We use rehabilitation therapy, so we use, say, photobiomodulation, and home exercises. That's key, making sure we build up that muscle mass. Dogs will not build up their muscle mass on their own, but just by walking. So many owners are just like, oh no, he's doing fine. I'm like, no, just
Well, thanks for that recap. Thank you for those 5 tips. Very useful. We will definitely be sharing those throughout. And if you have just joined, they will be in the show notes. You'll automatically get a copy of that. You can share it with other people as well. We really want to thank you for your knowledge. We look forward to those future subjects, because you guys go through in your clinic with so many of those injuries, and you have techniques and methods that can really help us. So I want to thank you for taking the time to be with us today. And we look forward to see you very soon again.
Thank you.